Well, good morning, friends. This is Casey Gwynn, and I'm joined by really an illustrious team here from Alliance for Hope International. I'm going to let them all introduce themselves. It's great to have you all joining us today. We're broadcasting live from San Diego, California, where we are really suffering through what's going to be a 70-degree and sunny day in San Diego. So let me just have us go around the room here on our end, and everybody can say who they are and what they're doing here.
He's looking at me, so that means good morning. This is Gail Strack. I'm the CEO of the Alliance for Hope International. It's so cool to be with our friends in California. I can't believe we are at phase 4. Oh my gosh. And just trying to review some documents this morning. What a journey. Congratulations to all. You have just done amazing things and you are inspiring the world as we go across the United States to meet so many new centers that are opening up.
Good morning, this is Jen Anderson, and I have switched roles as of the last few months into focusing on operations as the new Director of Operations here at the Alliance. Happy to be with you all and hear your voices.
Good morning, this is Natalia. I have also switched roles, and now I am all things nerdy and loving it. So I am working very closely with Chan and the rest of the team on evaluation and outcomes, and really enjoying that switch.
And this is Michael Burke. I've enjoyed connecting with each and every one of you that are on this call or just listening to a recording of this call. This is an important initiative, and I'm just proud to work with all of you. So thank you.
Thanks, team. It's great to have you here. And is Chan able to talk? Do we have him accessible? Chan, are you able to hear us?
I am here, Casey.
We're very honored to have Dr. Chan Hellman with us from the University of Oklahoma. Chan's actually going to be doing a webinar in about a month for us on February 26th, going deeper into hope theory. But we appreciate him sitting in on this call today. Chan, just tell us a little bit about yourself, and if you want to talk about the OU basketball team, that's okay.
Thank you, Casey. Chan Hillman. I'm a professor at the University of Oklahoma, and I'm also an associate dean for the College of Arts and Sciences. And my area of research is on the concept of hope. And so I'm delighted to be joining the Alliance and working with you all.
Well, it's great to have you on, Chan, and you have had a very profound and significant role in our whole journey, really, in the evolution of the Alliance over the last couple of years. We changed our name because of Hope Research. We changed our kind of whole philosophy, focusing and building our organization around the science of hope. And we have really begun now to dive into the measurement of hope and so many related topics around competency and resiliency and self-efficacy and so many other things that are important measurements of whether the work we're doing is really making a difference in the lives of trauma-exposed adults and children that we're working with here at the Alliance. And you can see our tagline on the bottom of every slide now for our folks in California, creating pathways to hope, which really is in the core of our vision statement and our mission statement now. So it's great to have you all on. Most of you know some of the members on the team. Most of you know everybody that's sitting in this room today, Gail and Natalia and Jen and Mike and myself. But we have a few others on our team that you may or may not know. Yesenia Seves is a professional artist who we recently hired full-time. She's worked over the years with us in art programs, but she is now the director of our new Pathways project, which is our national, state, and local Camp Hope program, where we have focus areas in all three, national, state, and local. And Yesenia is going to be leading the local Pathways project, which is focused on a year-round program for 100 children from San Diego and Imperial County, and a pilot that Verizon is funding and that we hope to see expanded eventually across the United States. So we're very excited to have Yesenia on our team. Most of you know my daughter, Carrie Ann, who is now running Camp Hope America. Carrie Ann oversaw Camp Hope for the last 2 years at Kidder Creek. And is now helping to develop Camp Hope nationally and will be overseeing all of our operations in California this next year. Ernie Lozano is our new Director of Finance. Chris Berlacca left for a job with the San Diego Workforce Partnership. And Ernie, who's retired Navy, just joined us. after 28 years in the military, and we're very honored to have him on the team. Lisbeth Perez, some of you know, Lisbeth is a former San Diego Family Justice Center client and survivor. She's also on the call. We're very honored to have Lisbeth with us on the call and at the Alliance. She is going to be running our Hope Project through the Avon Foundation. We're part of the No Mas campaign that Avon has helped to support through Casa de Esperanza. And Lisbeth is going to be working with Latina survivors and their kids in a program here in San Diego. So we're very honored to have her on our team, and she brings so much to it. Alyssa Smith, some of you know, who provides administrative support to us. And Yolanda Ruiz is a former Camp Hoper who has become a student at UCSD. And she is a psychology major, and we're very honored to have Yolanda on our team. We've hired her as one of our paid interns as well. So thanks for being on the call today. We always like to honor the sponsors of this. Most of you know that Blue Shield of California has invested millions of dollars in the whole Family Justice Center network in California over the last few years. That journey really started in 2007 and has continued to evolve since 2007. Just a quick recap of that journey. In 2007, Blue Shield asked to really evaluate the San Diego Family Justice Center. They funded a evaluation for a year between 2007 and 2008 of the San Diego Family Justice Center. Then in 2009, we began what was called the California Family Justice Center Initiative. Phase 1 was 5 sites in California, along with 3 regional training centers. Those training centers were the Alameda County Family Justice Center, the Orange County Family Justice Center, and the San Diego Family Justice Center. That initial phase 1 involved some regrants to sites of about $65,000. We ended up investing a little more in one site in Richmond, California. We invested $130,000 to help support the development of that center. And that journey produced 5 family justice centers out of phase 1. We then focused in phase 2, 2 years later, between 2011 and 2013, on sites, 5 additional sites, still using the regional training centers, and we saw a continued expansion of the Family Justice Center movement thanks to Blue Shield's really critical investment. Very much a parallel to Blue Shield's investment in the Strong Field Project, where they invested both money in community-based sexual assault and DV agencies and collaborative models like family justice centers at the same time. And then in phase 3, we continued to provide technical assistance and support. We focused on some work in Van Nuys, really trying to better understand the health needs of survivors, and developed a toolkit. If you haven't seen it, I would really strongly commend that to you. It's a toolkit that focuses on how to meet the healthcare needs of survivors and their kids. And then finally, the newest grant that we're involved in, we're going to talk about today, and it's really about measuring outcomes, and it really is the next stage in our evolution in the Family Justice Center movement, not just at the state level, but nationally. But we're very much focused here on first figuring it out in California. So we appreciate you all joining this call. We are recording this call. This call is really a precursor to our Directors Leadership Summit on April 11th in San Diego at our international conference. We will have a focus on these issues at the Leadership Summit and really talking about evaluation and outcomes. And we'll have a number of research folks with us there, including Chan Hellman. And so what we want to do over the next couple of months, particularly with the California sites, is be able to really start to articulate all of this. If your center or your team at your center has not registered for the conference, I strongly encourage you to do that. And if you have a particular interest in rooms, I strongly encourage you to call Paradise Point Hotel and Spa and make your room reservations. And if you want to be close to the water, you might want to call and ask them about rooms for that. Our rooms in our block are not necessarily all on the water, but you can pay a slight upgrade to get closer to the water. But we're going to have an amazing week in San Diego, April 11th to 14th, and we look forward to that. Just as an aside, not only do we have the Directors Leadership Summit focusing on this whole issue of outcomes and evaluation and trauma-informed work, but we're also going to be hosting a one-day Camp Hope coordinators conference that will start Sunday night and will go through Monday. And Carrie Ann will be leading that effort with the involvement of Mike Burke and others. And we will be focusing on the development of Camp Hope philosophically and organizationally, not just in California, but particularly across the United States. Verizon is agreeing to invest a significant amount of money in other states outside of California to help support the development of Camp Hope, which we're very excited about. So our agenda for this call, you can see on the screen if you're logged into the webinar, is really to explain the Blue Shield of California Foundation Hope Project, to discuss kind of the framework for implementation. We view this framework as really critical to the success of family justice centers, and we think it's going to be an incredible resource for you in applying for grants and going after money in the future. It's a framework that could be used in going after OVW money if you choose to pursue a grant under the new Grants to Encourage Arrest program, which is called Improving the Criminal Justice System Response to Domestic Violence and Sexual Assault. That RFP, by the way, is out right now. So we're going to talk about the framework for the initiative, which we think can be used by you in a variety of ways. We're going to talk about evaluation at two levels, one around organizational processes. What's the infrastructure that's necessary to do good evaluation work? It's not just slap a survey in somewhere. There's a lot of complexity to making sure that, one, you're doing trauma-informed work and you're really helping survivors to figure out what they need and then helping them to find that pathway to the goals that they want to set. So that's the organizational processes piece. And then there's the piece around outcomes. And one of the things that you're going to see us doing in this initiative and ultimately nationally is really starting to talk far more about how survivors define success, not how we define it, not how a police officer or a prosecutor or a director of a center might define it, but much more along the lines of how survivors might define it. I think Carol's comment was a very significant one, because in that journey to provide makeovers and really help women feel special, that piece, survivors have already told us, really is significant in helping them feel like they deserve better, they deserve to be treated with respect and honor. There's something very powerful in some of those things. So listening to survivors and what they want and need, and then being able to measure that and whether we're providing that as part of this conversation. So I'm going to turn it over to Natalia to talk a little bit about kind of the big picture of this. And I'm going to ask Jen to chime in a little bit with this as well. Both Jen and Natalia worked on this project logic model and description that you see on the screen. And quite frankly, after they developed it, Gail and I didn't have a very hard time writing our $300,000 Blue Shield grant because of the way they framed all of this. When you're writing grants, I strongly recommend that you consider this kind of project logic model approach, where you can really lay out your activities, your objectives, your outcomes, and see how your goals are going to get accomplished. So Natalia or Jen, you want to talk a little bit about what we see on the screen here that kind of explains our current grant from Blue Shield?
Sure. Thanks, Casey. So we'll just briefly start for any of you folks who don't have logic models or aren't familiar with them, but it really is kind of a framework for conducting a project. And you really, when you're creating this, start from the right and work your way backwards kind of to the left. So really, and we'll delve into this a little bit deeper throughout the presentation, but our overarching goal is to strengthen the integration of systems and partners in the FJC model to better serve and be held accountable to survivor needs and self-defined success. And we created some very tangible and we think feasible ways to carry that goal out that are defined in our outcomes at 3 levels of work. One, at the center individual level. So how does the FJC kind of meet those goals through intake and helping define survivor-defined success at the partnership or organizational level? So more broadly with its partners, what does that look like when you're integrating services? How does the system itself change in between partners? And then finally at the system and community level, and really looking at how we begin to engage and build a community for voices and for survivors who come through our doors. And then again, that further level of integration at the systems level and how we're all held accountable for our work.
This is Jen. I think I would just add that carrying out and reaching this goal, we're asking for all of your support in this. This is really a natural progression into phase 4 and what we've been building on over the last several years now. And in our last, in our time together in Fort Worth, and also at the learning exchanges we've held over the years, and also at the last conference in April, about really moving towards incorporating services and practices that are about being survivor-centered at the systems level and how we operate our family justice centers, and also how we define success. And we've really learned a lot, I would say, from the Full Frame Initiative and having Anna Melvin come present and speak with all of you. So we'll dive in a little bit deeper into that, and as we continue to move forward. This is just a larger overview, as Natalia was mentioning on the right in orange, the overarching goal of this phase, this initiative, and the 3 levels of work and how we intend to accomplish this goal. And we'll be sure to share with you all this logic model. As Casey mentioned, this is a great framework to use as you're approaching your own grants that you can use in your own work.
Thanks, Jen. We'll talk a little bit more about this as we go, but I'm very excited about kind of the way we're thinking about this journey, because just like we're trying to help individuals become motivated, find motivation to be able to achieve goals that they set, so both set goals and then be able to achieve those goals, we're also challenging family justice centers to measure themselves on whether or not they're really doing that. It's one thing to talk about it. It's one thing to actually do real evaluation where you can say, we changed the hope scores of people that are coming to us. We changed the resiliency scores of people that are coming to us. We can measure it, not just how many restraining orders did you issue, how many cases did you issue, how many clients did you serve, but what's really going on in their lives and how have you helped them navigate that. You'll see that Jen and Natalia put up a slide here. They really contrasted trauma-informed philosophical kind of foundation with our FJC guiding principles. The trauma-informed care piece, for those of you that were at our Directors Institute last year, came from the National Center for Trauma-Informed Care, and a presentation that SAMHSA did for us last year in our pre-conference Directors Institute. And on the left are really those fundamental principles of a trauma-informed approach. And you'll see that almost 10 years ago, Gail and I worked with a national advisory team and many people that are still very much a part of our work today to look at the guiding principles that we wanted to build the Family Justice Center movement on. And you'll see the incredible parallels between what they're teaching today at SAMHSA about trauma-informed care and what we were espousing 10 years ago about the goals for family justice centers. So we have decided to really keep our guiding principles. We may tweak them slightly here and there, but we think that we have really stayed true to those in many ways as our organization has evolved. But we also think there's still a gap in how family justice centers operate and whether or not these principles are really being lived out day to day in the way centers do their work with survivors and their kids. So I'm going to ask Jen and Natalia again to just talk a little bit about this thinking about kind of the culture you're trying to create in a family justice center and the processes that are necessary to create that culture. I like the visual here, but I think it's important to kind of articulate that.
This is my attempt at clip art. I thought it was fun. As Casey mentioned, I think this is how you can live out the guiding principles. And this picture at the umbrella level, it is how to create an organizational culture that is survivor-centered and upholds Family Justice Center guiding principles. So asking that all your partner agencies, as you integrate your services and integrate your paradigms, that you create a new paradigm that is about being survivor-centered, survivor-driven, and defining success based on how survivors see success. And at the process level down below, these are policies and procedures that create a survivor-centered culture. So we want to see policies and procedures that remove barriers and increase access to services, that support survivor and also the staff needs. So it really creates a culture of wellness, fostering health and wellness, and promoting autonomy and empowerment amongst staff and also amongst survivors that are seeking services there. On the right under the umbrella, these are tangible ways that you can integrate and implement these policies and operationalize a survivor-centered culture. So writing it into your operations manuals and your intake procedures, creating a communication plan that fosters health and wellness, creating contracts and agreements that foster these guiding principles, and centering your staff meetings in such a way that it's promoting health and wellness. As Gail, I think, had a lot of examples in her tenure as the founding director of the center in San Diego.
Well, and I'd actually like Gail to just talk about that for a minute, because Gail always talks about the power of we, and she loves that phrase. I like that phrase too. And I think one of the things that we're talking about in this, and let me ask Chan to even comment on this too, but the power of we is not just about us serving them or us providing services to them. The power of we is about the culture that we're creating and the relationships we're creating for both professionals that work in centers and survivors. Because the bottom line is that if the staff isn't finding hope in the work that they're doing, and if they're not being taken care of, you end up with this great anomaly where you've got low hope scores in the staff and higher hope scores in the clients, and you've kind of failed. So Gail, can you just talk for a second about the power of we?
Well, I'm just thinking now that maybe we should have done Hope Theory and A scores at our Family Justice Center before we got started. That would have been an interesting test. Just like we've been using new tools of Strengths Finder, this would have been so cool. But absent that, I think we were doing it anyway without having those tools. As many of you know, it was really trying to create an environment where we really honored and appreciated each other. And it was those guiding principles that I keep going back to, that if you think about it, it really is a vision for what a family justice center should be. But I know we got a lot to talk about, so I think we just keep on going.
So I think this really is, at the end of the day, about hope. And you'll find in almost everything we're doing now that we're beginning to move down this road of seeing it, finding it, measuring it, asking if we're helping to produce it. I will tell you that this is the future. Gail and I had the opportunity to be in a national think tank in the Hamptons in December with the Chapman Perlman Foundation. And Marianne Dutton, who's a researcher at Georgetown University, is doing research on one of Joyful Heart Foundation's projects around domestic violence retreats for survivors. And she presented some of their preliminary findings using Hope Theory. And we were very excited to see Hope Theory built into her evaluation model. Yesterday, we talked a little bit about this on a webinar I did with the Battered Women's Justice Project, and I talked about Camp Hope America and hope. And a researcher from the University of Toronto and a researcher from the University of West Virginia said this whole thinking around hope and pathways is the future, and we've all got to go there. So that was very encouraging to me. And I don't know, Chan, if you're on and you can share this, but can you just for a minute talk about some of the research you've done looking at hope scores for service providers versus hope scores for the recipients of services, and this whole issue around making sure that hope is increasing for the people providing help to others as much as it is for the hope givers, if you will.
Sure. Thanks, Casey. Just real briefly, one of the studies that really stands out that we've just completed is we looked at a nationwide study of child abuse pediatricians. And this is a new board certification for the pediatrics. And what we found is that higher HOPE scores were associated with reduced burnout and compassion fatigue. So HOPE is a protective factor in high stress work environments. What we also know is that high HOPE providers are better able to provide services and frameworks and pathways for the clients that they serve, therefore a catalyst for client hope. So just real quickly, that's some of the early findings that we have.
That's great. That's very helpful. So when we're thinking about this, we're not just thinking about survivors and their kids. We're thinking about the partner agencies in your centers. We're thinking about volunteers. We're thinking about the people working there every day from the front counter through every service that's getting provided. And in that process, we really want to be beginning the process of thinking about outcomes and impact. Very few centers anywhere in the country, including California, have done much outcome work. Nobody's published anything to our knowledge. We are going down the road first with publication out of the Camp Hope world around camping and mentoring, and we want to go down the same road with family justice centers. The early research from Dr. Carrie Petrucci in California Family Justice Centers was very significant in looking at a couple of different things, but it didn't so much give us a sense of this notion of long-term outcomes and impact inside centers. There was a lot of things we were able to measure around potential impacts, but we've got a lot more work to do around this to see what we're really producing in true change in the lives of survivors and their children. It was interesting. Yesterday, I was on this webinar with Barbara Hart and the Battered Women's Justice Project team, and I talked about Maslow's hierarchy. This is Maslow's hierarchy for those of you with a social work background. When Maslow produced this in 1955, the top of that pyramid was self-actualization. It was not hope. And it was very interesting. After the call yesterday, Barbara asked me why I put hope at the top, and I said I put it at the top because she put it up on a slide in San Diego in 1998 when we were planning the San Diego Family Justice Center. And Barbara said, I didn't know that you even saved that slide. And I said, it's in every presentation. And she said that was one of the first times I'd ever put hope at the top. And she said, since then, hope has appeared in over 50 publications of Maslow's hierarchy since 1998. It wasn't there 30 years ago. People weren't thinking about it, defining self-actualization as hope. So this whole notion was very interesting to me that Barbara said she put it up there because for her, as a survivor herself, the top of that pyramid had to be hope, that self-actualization didn't mean anything to her. But having goals and pathways to achieve those goals and the motivation to get there for her was what it was all about. And for her, that was hope. So it's very interesting that when you think about this pyramid in Maslow's hierarchy and you look at all the things that have to be happening in order to get to hope, you understand why Gail's phrase, the power of we, is so incredibly important. For those of you that haven't read Cheering for the Children, I really encourage you to do it. I don't get any money out of it. All the proceeds of Cheering for the Children go to our Camp Hope program. But we've gotten a lot of positive feedback from both survivors of trauma and abuse that have read Cheering for the Children and from those working in family justice centers, that it really helped them think through this whole notion of both pathways to hope and hope theory and the whole notion of adverse childhood experiences. We can't be trauma informed if we don't understand the trauma that people have experienced. So I just want to give a plug for the book. If you haven't read it, we're getting a lot of positive feedback across the country, including yesterday on this national webinar. So hope theory, and I'm going to let Chan just comment briefly on this. Hope theory has really been around for quite a long time. If you look at the research, hope theory is kind of everywhere in the research, but it has not really been used a lot in measurement until the work of Dr. Snyder at the University of Kansas. And Chan, I'd love you to just talk about the evolution of that, kind of the early thinking about hope theory, and then kind of how it's started to evolve. I know we're going to do a whole webinar next month about it, but I'd just love you to talk briefly about the genesis of hope being articulated as a theory in and of itself.
Sure, Casey. So Dr. Snyder originally came up with the concept of hope in a study that he was doing on excuses, in which individuals were forced into an experimental design where they did not succeed. And so as he was doing interviews with them, he saw that these individuals were able to articulate pathways and strategies to be successful in the future. And that's kind of how the hope theory started, with pathways and sort of motivation towards those pathways. You can see that Casey has the basic definition up there, that it's comprised of two basic components: pathways and agency. Another way to think of that is willpower for agency and way power for pathways. So it's a cognitive theory, motivational theory that has been very successful in the literature for achieving success, however that's defined.
Thanks, Chan. And we'll talk more about that in our call in February. But at the end of the day, high hope people do much better in life than low hope people, and high hope people do much better in the context of trauma and obstacles and challenges than low hope people. It's pretty commonsensical to me, and we can see in a variety of ways why hope is so central to almost all outcomes research. If you see effectiveness in social services, if you see effectiveness in change in the lives of people impacted by trauma, violence, and abuse, you're always going to find hope playing a role in that in their lives, both this notion of agency or motivation, their thinking about it, and then their ability to actually have real pathways in order to get somewhere. So it's that background that introduces us to the framework that we are building for this initiative. And I'm going to just quickly go through each of the elements of the framework. You may have seen this on the initial Project Logic model, but affiliation is right at the top of this. We had 15 Family Justice Center directors, including Rebecca Lovelace from Idaho, who's now working with us on our team part-time here in San Diego, go through a whole process of thinking about how to set standards for family justice centers and how to really start talking about how both family justice centers and other types of multi-agency models can measure their effectiveness. But in order to do that, we believe we've got to start setting some standards and holding centers to standards. So we just opened this affiliation process. We announced it last year. We have centers beginning to apply to be affiliated with the Family Justice Center Alliance program of Alliance for Hope International. And if you haven't looked at our affiliation, I'd encourage you to go to familyjusticecenter.org and click on affiliated centers and see the process that Jennifer and Natalia are overseeing now as centers begin to go through this process. We're going to be starting to announce affiliated sites this year and really start looking for alliances, for grant opportunities, and for other ways that we can make the pie bigger together for the Family Justice Center movement. And we're going to start talking about centers that are affiliated with us and centers that aren't affiliated with us in this process of really making sure that when somebody says they're a family justice center, they're living out the guiding principles of the alliance that have been identified that are so consistent with trauma-informed care. And they're involved. They're involved with the conference. They're involved on these calls. They're connected to the evolution that we're going through as an organization and that family justice centers should be going through as well. So if you go back and you look at the Project Logic model, you'll see that under activities, at the original individual level is this whole notion of affiliation. It is the foundation, if you will, for what we're doing here to align the centers in California, to connect them, and something that Blue Shield feels very strongly about in going forward. I think as centers try to pursue money either through partners or through their own connection with Blue Shield and allied agencies of Blue Shield of California, this affiliation piece is going to be important because they want to know that the centers centers that they're going to be supporting and funding have this kind of commitment to guiding principles and to measurable outcomes. The next kind of piece of this connects to this whole notion of promising practices and ultimately what we will deem as the research begins to evolve into best practices. For us, a promising practice is something that really has very positive looking outcomes. We have a lot of anecdotal data. We have good feedback from survivors. Best practice is really something that comes out of research, that comes out of evidence-based practices where you can document it in outcomes. And we have some of those. Certainly we have outcomes now headed to publication in the Camp Hope world, thanks to Dr. Hellman's work and his graduate student team at the University of Oklahoma. But in the process of getting to best practices, you're really trying to identify promising practices. And for us, this is a focus on both the notion of trauma-informed care approaches and long-term services, or what we call creating community long after the crisis. The notion of creating community long after the crisis is something that funders love and support. In fact, the Avon Foundation just funded us in the No Mas project because of our commitment to try to create community after the crisis for Latina survivors and their children in San Diego. That was the key part of our grant that made it one of the highest rated grant applications in the whole Avon Foundation RFP process. So this notion of long-term care after the crisis is very important. The other piece that we believe is really important is this notion of the full frame initiative. Those of you that have heard Anna Melbourne, have been at our conference, know what the full frame initiative has been doing. They're an OVW TA provider grantee and have been doing a lot of thinking and surveying. Blue Shield hired the full frame team to come into California and work with the California Partnership to End Domestic Violence and the Strong Field Initiative to really look at this whole issue of the comprehensive needs of survivors and the long-term needs of survivors and what those look like and how you can measure whether you're meeting those. And once you understand the full frame initiative, you see the importance to modify the way we're both doing intake and the way we're providing connection and relationship, or what we sometimes just simply refer to as services, if you really want to get to creating community after the crisis. I'm not going to spend much time on this, but I will tell you that I believe, and our whole team believes, that connecting with the full frame initiative and diving into what are referred to as the 5 domains of well-being are a very significant part of our future in multi-agency models and in family justice centers. Are you creating social connectedness for survivors long after the crisis? Are you really helping them to find that notion of mastery or self-efficacy, that ability to find things that they can do well and figure out and navigate in order to be empowered? Because that's really what empowerment is all about. And are they able to find meaningful access to services and the services that they actually want and need? I think most of us think a lot about stability and safety, but we don't think a lot about those other 3 areas of the domains of well-being. So I don't know, Jen, if you just want to comment on the full framework around this, but I do think it's important for us to be thinking, even as we're going into this whole measurement and outcomes piece, how important it is to look at the holistic needs of survivors instead of just, well, let's get them a restraining order, or let's get their case prosecuted, or man, we got to get them into counseling and then we will have done our job.
We really see the full frame initiative and the 5 domains of well-being as being in complete alignment with the Family Justice Center guiding principles, and also connected to hope theory, being that it is a strengths-based approach to engaging with survivors and other staff, for that matter, and partners, and that we are all working under an organizational culture that adheres to this framework. And this is really phase 4 of this initiative is focused on integrating this framework into our practices and helping each of the centers really, as Casey said, live this on a daily basis.
So we want to talk a little bit about the 2 levels of evaluation that we're going to be focusing on in this initiative in the context of this kind of holistic approach of the full frame initiative. The first is really the organizational level. and a commitment that we have both in California and ultimately nationally to really push toward trauma-informed, kind of navigation-oriented service model based on the guiding principles that we talked about earlier. And really start thinking through, and these should be conversations I would propose that should be happening in weekly meetings at family justice centers. They should be happening in regular revisiting of your strategic planning process and your strategic plan. What does it mean to be victim-centered? What does it mean to be survivor-driven? And that survivors should be in those conversations. Survivors should be part of those conversations. They shouldn't be a mascot. They shouldn't be an afterthought. They shouldn't be an add-on. They should be equal thinkers, decision makers in the middle of the dialogue about what being victim-centered means and what being survivor-driven means. So for us, there's a lot of organizational thinking that has to happen at that level to make sure that we're laying the groundwork for doing healthy and dynamic evaluation as we go. And part of that also includes the whole notion of the client services toolkit, which we are in the process of updating. It's actually an available document now, though we're continuing to evolve it. It's very much an evolving document. As we've even of late been thinking about intake and the whole issue that the Justice Department has raised about criminal checks of any kind, or even opens records checks, and the need to reconsider that. And we've been giving very thoughtful consideration to that too, looking at Alameda County Family Justice Center, where they don't do that criminal history check of any kind at intake, looking at the Contra Costa County Family Justice Centers, where they're not doing that kind of background of any kind at intake. So this whole notion of the toolkit being evolving is very real. But it has to do with a lot of other things besides that little piece of intake. So this client services toolkit, we're going to be continuing to train on and put out. If you haven't seen it, you can contact us, but it's a very important piece. The other piece that Blue Shield was interested in is the implementation of our health services toolkit. Some of you know that we've done a lot of work around near fatal and non-fatal strangulation cases, and one of the things that Gail and her team have found in this process that Jackie Campbell has now acknowledged is that strangulation wasn't recognized early on in the danger assessment development as being as significant as it actually is. It is right there with the use of a gun as far as the predictive nature of it about lethality and homicides. So this notion of kind of implementing the danger assessment, not only to make sure that we're capturing the most dangerous clients and figuring out what they need, that we actually know who they are, but also being able to use the danger assessment tool to screen for health needs and to really focus on how we can add a few more questions to the danger assessment, not to change the instrument, not to change scoring, but follow-up questions that really help us figure out what the health needs are of survivors. If all you're asking is, were you ever choked? And the answer is yes, and you ask nothing else, you've missed the whole point of the question in the context of health services, which is, what do they need? And are they suffering symptoms from that? And how many times were they strangled? And did they lose consciousness? Or did they have a near fatal incident where they suffered anoxic brain injury or permanent brain damage? So there's a lot of follow-up questions that we're working on with Dr. Campbell and our team to think about this. And it comes out in our new health services toolkit that we have produced, that if you haven't seen it, is going to be part of this journey also. And then finally, the last piece of organizational foundation is really the implementation of Penal Code Section 13750 and its related sections. 13750 was included in AB 1623. Penal Code Section 13750 is the section that we wrote for family justice centers in California. It's the legislation that is now law in California. Every California family justice center should not only be reading it, but following it. Because there's a lot of interesting little pieces of 17350 that you need to be following. And they're important, we believe, for this foundational notion of being healthy and functional. And then from an organizational level, at the outcome side, is really starting to gather the kinds of information that you need in order to measure these things. Are your partners actually benefiting from what's going on in the Family Justice Center? Are you regularly asking them? We find that centers that aren't very healthy have no idea what their partners really think. And centers that aren't really healthy aren't even talking to their partners about, are we meeting your needs? Are your agency finding that you're doing more effective work? Are we taking care of your staff members that are at the Family Justice Center? Are we really integrating what you do into how the center operates? Some of those kinds of things. And so that you can see kind of overall all of these foundational pieces to evaluation before we even get to the evaluation part of the equation. And then I'll have Michael talk just briefly about this element in the Blue Shield project, which is around survivor engagement. Our goal in this initiative is, by the time it's over next year, that we have survivors involved in decision making and leadership and representation in every Family Justice Center in California. We intend to put some money behind that. Both funding survivors to be involved in activities with other survivors in your communities connected to your centers, and in bringing them to our conference in April. We're going to invest resources in that as well. So I'm going to let Michael just talk a little bit about where we are in that process.
Hello, everyone. And what we're really talking about is survivor engagement at the organizational level, where survivors are at the table. I'll never forget a California Initiatives conference that I was at, where survivors stood up and said, we don't want to be mascots in this movement. We need to be partners at the table. And we take that very seriously. And we started this creation of a statewide Voices network. And you can see the members of that network here. We are looking to expand that network with other Family Justice Centers. So if you're on this call, I've talked to most of you. If you do have a Voices survivor you want to put on this network, please contact me. Or if you're thinking about starting one, one of the very first tasks of this group is to re-engage our Voices toolkit, and they're looking over the toolkit and making sure it's accountable to survivors and something that we need to do. We're looking at this toolkit actually was created for survivors by survivors, which is what Voices is all about. And really creating that strong network in your center with the support of the Blue Shield of California Foundation. And so if you have any questions about Voices or you want to learn more about it, please give me a call. There's been successful efforts throughout the country. And in this work with Voices, we will be working with the statewide network to kind of get down to the organizational and individual FJC to really implement this HOPE survey that we're going to be learning about in the next several sessions together. Really looking at evaluation and HOPE surveys. And you can see this great graphic that Chan's team made for him about HOPE and HOPE theory and what HOPE's all about. But really having this Voices committee in your centers, reviewing your policy on your boards, sitting at the table, and really equal partners in this work.
I didn't catch the whole story, Chan, if you're still able to speak on the call, but you found this on your door. Was it your birthday or what was it?
No, a group of my students took my PowerPoint presentations from the research that we had done on HOPE and presented us with this poster as an infographic, which is just fantastic. And it's a nice way to communicate the HOPE concept and the evaluation results without being full of numbers.
Yeah, we love it, and I love the notion in the bottom right corner that this notion of repeated unsuccessful goal pursuits leads to hopelessness, because that is the reality of survivors trying to get out of an abusive relationship. That's the reality of survivors trying to navigate whether it's educational goals or whether it's safety goals or whether it has to do with kind of other things with their children and being unsuccessful because they don't have real pathways. and eventually getting to the point where they have no motivation. They've given up because the pathways just aren't real. And that's what family justice centers need to be doing, is producing real pathways for survivors. So we're going to be talking a little bit about it today, but we will talk more about it at our summit on April 11th. We are diving into this full frame initiative piece around survivor-defined success, and measuring, first asking what survivors do mean about success to them. What does success mean when they walk through the doors of your family justice center? What does success mean when they walk out those doors? What are the goals they have for themselves that they would say, if I do this, then it's been a success in my life, or if I've achieved a goal. So what are those goals that survivors have? And it's very clear from the Full Frame Initiative that the goals that professionals create for survivors are not the same as the goals that survivors create for themselves. And the dissonance between our goals for survivors and their goals for themselves is why so many programs fail to really meet the needs of survivors. The Full Frame Initiative has really been diving into this thought and thinking, and they have gone pretty deep. They did nationally, they did in their work in California with Blue Shield of California Foundation and a number of other foundations. And really, the bottom line is what I just said, that the definition of success for survivors isn't the same as our definition for success. And that we actually don't know how survivors define success because we haven't been asking them. And so the example that Full Frame has, a couple examples that Full Frame has found that survivors' examples of success connects mostly to relationships and connects to their ability to make decisions about their lives. And the great irony of the intervention of the civil and criminal justice system in America in the lives of survivors is, if we're coming in and acting on them, as Ellen Pence would say, through the child welfare system or through the criminal justice system, if we take a power position with them to say, oh, we're going to do this and you're going to do that and we're going to make you do this, and if you don't do that, we're going to take your kids away, or if you don't do this, you're going to answer to us for that, we are actually totally, completely destroying the whole notion of well-being that survivors need in their lives if they're going to navigate a pathway to hope and healing and safety and an end to violence in their lives. So this whole notion is going to be very central to this work and this whole thinking about it. I mean, just to give you an example, just one example, in survivor-defined success kind of thinking, if you ask a professional, as Full Frame has done, what's success for you in working with a victim of domestic violence, generally the number one answer is she leaves her abuser. And therefore, if she doesn't leave her abuser, she's a failure and you're a failure because of how a professional defines success. If you ask a survivor, she doesn't put that at the top of her list. She may say, I want to be able to make decisions about my own life. I want to be able to have the power over what happens with my kids. That may be a precursor to later being able to get out of the situation or later being able to see the violence stop. But the beginning of that journey is not leaving the relationship or seeing the violence stop. It's trying to have some power over her life. So this whole piece for us is an incredibly important one. We'll talk more about it as we go. But our goal is to really challenge centers around this topic so that we can basically truly be able to say that we know what survivors want and need and how they define success. I would venture to say that many community-based domestic violence organizations don't know what survivors define as success either, which the Full Frame Initiative has found because they're not asking either. And they have their own definitions of what success is. So ultimately, at the end of the day, we want to create multi-agency collaborative collective impact models where we are actually letting survivors define success, and then we're measuring our ability to help them find a pathway to achieving those goals. I won't belabor this. There's a lot of slides on here. We're going to talk more about this at our conference, but I did want you to just see some of these dynamics of what survivors define as success and what practitioners define as success, because you can see kind of the cognitive dissonance between the notion that professionals have and the notion that survivors have. And it's pretty consistent at the end of the day with what I've been talking about over the course of this. Only 7% of survivor stories overall were about leaving or altering the relationship with the abusive partner. 93% were about connections with people, being able to set goals and then achieve them, and being able to find stability or the ability to live their lives day to day without being afraid and without violence and abuse. And that for us is the future. So next month, we're going to be diving much deeper into hope theory. You really need to be able to articulate hope theory yourself if you're going to be able to articulate it to your staff. Chan and his team are an enormous resource for us in this project. They're, as you know, leading our longitudinal research on Camp Hope America, which we're in our third year of now. And we believe that 5 years from now, it will be truly a measure of the effectiveness of family justice centers if they're measuring trauma and they're measuring hope, and they're benchmarking hope when people walk in the door, and they're measuring hope when people move down that road through their goals and objectives to be able to talk about success. And it won't be about how many restraining orders you issued or how many cases you prosecute or how many children got into counseling, though those are all great things and important things, but it'll be about are you really increasing hope in the lives of people that you're working with? So we're excited about that. The second webinar is on February 26th, and you can see that. We hope that you will join us for that. That will go much deeper into hope and how you measure it. And Chan will present some of his really groundbreaking work. University of Oklahoma is one of the leading hope research centers in America, and Chan has just been such a critical thinker in all the work that we're doing. The third webinar to prepare for the conference and our time together on April 11th will focus on implementation and what that looks like once you do define survivor success, once survivors are able to tell you exactly what the goals are that they want to set. How do you then measure that using hope theory and a variety of other instruments to be able to answer the question, are you making a difference in the lives of the people you're serving on a day-to-day basis? And then this will come together on April 11th at our Directors Leadership Summit. So I'm going to go ahead and stop there. For the purposes of this call, we'll probably end the recording there, but I really want to strongly encourage you to pass the word. If there are others that should be involved in this call from your center in the next call on hope theory, I would encourage you to include them, both your survivor representatives if you have them, maybe steering committee members or part of your leadership team at your centers. This can't be just one person. It can't just be the director. It can't just be a program person. We need to start challenging everybody in the context of Family Justice Center work to be thinking about these issues. So I don't know if we have any quick comments or questions before we wrap up, or if anybody on our team has anything they want to comment on before we conclude the call. Any comments, questions, observations?
Casey, this is Carol Shipley, and I just want to thank you and your team. I think this is outstanding. I think it's a great time for us because we've been evaluating, and we're going to start meeting together to strategically plan our FJC from now and for the next 10, 15 years. So this is just perfect in reevaluating all of our processes. So it's great timing, and I thank you guys for the hard work you put in on it.
Well, thanks, Carol. We appreciate that. And I think it's time for all of us. We have a member of our board, Bob Martin, who says that if an organization isn't reinventing itself every 5 years, it will die. And I think that's a very accurate statement. If you look at the research on organizational development and organizational health, you are going to find that no agency just arrives somewhere and then stays there. If you're not going forward, evolving and reinventing yourself, you're slipping back down the hill and you're losing what you had already gained. So this notion of reinventing ourselves, it's been true for the Alliance. And when you look at family justice centers, quite frankly, even in California, if there's a center that's really dynamic and healthy, It's been constantly reinventing itself. And if there's a center that is really struggling, and we have a variety of them in California, they actually stopped evolving and they just settled for, okay, this is who we are. And invariably that produced ultimately decline and therefore a lack of effectiveness in the lives of survivors and their kids. So thank you all for joining us today. We're going to go ahead and wrap up this call, and we look forward to talking to you on February 26th.